Yeah, I think that first, as I said earlier, that first year out of specialist practice, that was tough.
Mm,
I found it really stressful. I think had I not had, I guess, a mentor with me, a boss who really took me under their wing,
mm,
that would have been really hard.
yeah.
So that was a really unpleasant first 6 months.
Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia.
Greetings, CPD Junkie podcast fam. I'm your host, Lawrence Doan, and today we're joined by Dr. Harry Mohan. He completed his BDS at Melbourne in 2008 before commencing work with the Royal Australian Air Force, and then transitioned to private dental practice in the Blue Mountains in the New South Wales Central Coast. He later completed his DClin Dent in Endodontics at Melbourne in 2015. He worked in Sydney in a group, a specialist endodontic practice, before opening up his own practice in Shellharbour in 2016, and then a second location in Gregory Hill in southwestern Sydney in 2021. Dr. Harry Mohan, welcome to the show.
Thanks, Lawrence, and thanks for having me on.
So before we, dive into, you being a specialist, you're a general practice working with the Air Force. So where did your CPD journey or dental journey start?
Yeah, well, that's right where it started. So I took an Air Force scholarship when I was in my second last year of uni. So I did a 5-year program at Melbourne. So yeah, in the fourth year, I took that scholarship on. And then when I graduated, jumped straight into the Air Force as a dental officer. That was fantastic. Like did, the full 4 months military training and then posted to an Air Force base in Adelaide and then another one in Sydney. But the thing there is it's really structured mentoring within the Air Force, particularly for the dental category even. Like you've got a senior dental officer who mentors you. Then within that category, they expect you to do, certain things to progress to the next level. So, they expect you to either sit your fellowship exams for the RACDS, or you can do a grad dip in sedation or oral surgery or something like that. And that they want you to meet those milestones as part of your progression. So that's where it all started, the CPD journey. And then on top of that, I think the mentoring, you had specialists visiting the Air Force base once a week. So you had specialists in the reserves. So we had, specialist prosthodontist, periodontist, max fax, they're all reservists, and they come on base and they treat the base patients for the specialist care. But because you're, a member of the Air Force and you're on a fixed salary, it's easy to just block a day off. There's no pressure to, meet commission or goals in that sense. So you just block a day off, sit in with the specialist, watch for the whole day. If you've got a case that you've referred, you just watch that case and they sort of walk you through it step by step. So, it wasn't like CPD, like going to courses and sitting down for a day, but it was mentoring. That was really the journey that was there for the Air Force.
That's even more crucial because, people can talk about things, but to see them actually do it and apply it is like another level.
Yeah, and then to have that applied to your own case and for them to be like, okay, well, walk you through from diagnosis to the whole treatment steps, 1, 2, 3, all the way through, was fantastic. So that's where it all started. Yeah.
Right. I'm surprised to hear that. Yeah, they really encourage you to kind of do the primaries and the fellowship and all of that. Like I would have imagined they would have kind of kept you in the realm of just general dentistry as a dental officer.
Yeah, I don't know what the rationale was, but I guess they just saw value. Like, this is what we want our people to be better. We want them to get better and better as they progress. And then once they progress to a certain point, they're going to have to mentor the next group. So yeah, I don't know what the thinking was, but I certainly agree with it and I certainly benefited from it.
Right, yeah.
So, yeah.
It might just be upskilling and trying to getting a holistic idea and understanding to a deeper depth, maybe.
Yeah, that's right. I think, and also retention.
Yeah.
So I think, because you can only do that after you've been in a couple of years, then you get to do the next level. So I guess as a means of retaining people in the workforce as well, it's a good incentive.
Yeah, because like you said, you took on the scholarship in your second year, so it would have been 1 plus that, but you stayed on for an extra year to.
Yeah, so I did my whole program. Then I went into specialist to private practice after that.
Yeah. So how's that?
Yeah. Yeah, so that was a big change. I mean, because when you go from Air Force to private practice, like it's so many things you got to start from scratch. Like hadn't treated any kids for starters, so all of a sudden, you're like dealing with 6, 7 year olds and trying to keep them calm.
Yeah.
So that was interesting. And then, of course, Air Force patients don't have to pay for anything. So then you've got to meet that whole side of like communication and presenting treatment plans and that sort of thing.
Yeah.
And then in the Air Force, it's so out of the real world. Like there's this thing called toothbrush parade, where if someone's
Right.
not brushing their teeth, you can compel them to come to your office every morning and brush their teeth in front of you before
No
they go to
way.
work. So like, all those things, it's not real world scenario. So when you put into private practice, it was a big learning curve.
Yeah.
But again, I was lucky. I worked in 3 practices actually. I worked in Sydney at Pacific Smiles Group. I worked in the Central Coast in Wamberal with Neil Tuddenham, and then I worked in the Blue Mountains
Yes.
with Tony Eunice. And so I was doing 2 days, 2 days, 2 days. I was working 6 days a week. And I got to work in different demographics. I had different mentors, different practice scenarios, different equipment at each practice. So
Yes.
in that sense, not being in just one place, I got to really experience a lot. And yeah, that was yeah, it was the next step, wasn't it? So just to get into private practice and sort of understand like more real world dentistry, I guess.
Yeah. Was that
Yeah.
something that you planned? Like you planned that I want to work in if like part time as opposed to just solely being full time at one place? Or is that just how it all kind of fell into place?
I think it was, yeah, I can't really remember how much thought I put into that.
Yeah.
But it just sort of played out really well.
Yeah.
And it might have been even that I sort of started in one place thinking, okay, if this gets busy, I'll
Take on
move
more
up to the
days.
next level.
Yeah.
I think minimum you would have to work 2 days. I think one day is really hard
Yeah.
to build a book because even like when you're working one day a week, if it happens to be a Tuesday and you do a consult and they're like, oh yeah, but I can't come on Tuesdays. Well, then all of a sudden, it just becomes a nightmare. So I think minimum 2 days a week, you want to be somewhere. And also that way you get continuity with your staff as well. Because one thing I found now in particular is, I invest so much time training my staff up, getting them to a point where they are integral to my practice. That if I didn't have that continuity now, like if I was doing 2 days or one day, one day,
Yeah.
it would just make my work so much less enjoyable,
Yeah.
not to mention less efficient.
Yeah.
So I think you want to do minimum 2 days. And it
Mm.
just worked out really well. And I was happy working 6 days a week at that age.
Yes.
Now, hell no, but yeah, back then for sure.
Still a hustler. But like, I mean, these practices aren't close by to each other. They're like quite far away from each other.
Yeah,
So
yeah.
how is that for you? Because you've been traveling like, nonstop.
Yeah, I mean, living in Sydney, you could travel 5 kilometers. Some days it'll take you 1 hour. So
Yeah, that's
uh,
right.
those days, yeah, I was traveling hour and a half each way to the Central Coast and to the Blue Mountains, but it was worth it I just enjoyed the work. Back then, I didn't really care. Just hopping in the cars, listening to the radio.
Yeah.
And all my mates were doing the same thing. Even like I graduated in Melbourne, some of my mates were still based in Melbourne, but they were all doing the same thing, like driving. So we would all just get on the phone to each other and just have a chat in the morning. And
In the
then,
bumper to bumper traffic.
yeah, that's it. But I don't know. I think if the work's enjoyable, even now, like my Shellharbour practice, because of my wife's work, I don't actually live near my practice. My wife works in Sydney at a hospital here. So I drive an hour and a half to work. But if the job's right, if the environment's good, the team's good, the patients are, really pleasant, I think it's worth it. I mean,
Yeah.
yeah, it's very few people I think who can live right next to where who want to live and work in the same place. It doesn't always match up that way, particularly in dentistry.
Yeah.
So yeah, it's something I've just gotten used to, and I still enjoy.
Fair enough. So then, obviously, you were in the Air Force and you were doing like the program that had structured learning. But then you came out and you're in private now. So how are you kind of deciding what you're going to pick and choose? I mean, you mentioned briefly like talking to patients, communication was one of the things that, you know, you felt like, oh wow, like this is a new leap. I mean, yeah, where did you go from there?
Yeah, so at that point I was 4 years out.
Yeah.
And I don't know about you, but like I still felt like I wasn't great at anything. I was decent at a lot of things, but I wasn't like, I still found a lot of things stressful, like indirect restorations. You know, when that came back from the lab and it came time to cement it, I was always so stressed whether it would go, like whether it would seat and, you know, and then having to problem solve, why isn't it seating the way I, what was it, the impression, was it the, you know, this, that, and the other. And so I just thought, you know, I got to learn so much. So I just tried to do all different sorts of courses. Like, even though I was interested in endo already, I didn't just do endo course. Like, I was doing fixed pros, I was doing direct restorations, I was doing endo. I was a member of my local study group with ADA New South Wales. So that was the one near where I lived. So I was going to the Inner West group, which Steve Harlan was heading up at the time. It still does, I think. I was in the ASE just as a member. So I was attending ASE meetings. So I was still, even though I was 4 years out, like I still considered myself very much a novice. So still wanted to just get that full breadth of learning. And so I wasn't really that discerning. I was just trying to whatever was coming up on a day, preferably that I wasn't working and preferably within my budget. I was like, all right, let's just go under that. And back then there wasn't the like online learning as much. I mean, there was Spear and a few other things had started, but it wasn't like it is now, where, you know, there's so many courses available online that you could log into across the world. So back then I was just, you know, anything. And sometimes I'd try and do a sneaky holiday, like duck down to Melbourne, do a course, catch up with friends, come back. So a bit of that went on as well. But I was just really at that stage, just trying to just go full breath. Anything I can get my hands on, I'll do it at that stage.
Right. So like, I mean, how did you pick it? Like, did you call up friends, or like you're hearing about reviews about a particular course, the boss was recommending some courses?
So even
like,
then, this is like pre-DPR, right? So this is like, there's no real communication within the whole profession yet. You know, like it's more just mates. Oh, my mate did this. All right, or you know, you get a call from a mate. Hey, I'm flying up to Gold Coast to do this course. You want to come? You're like, oh, that sounds fun. Yeah, you know, hang out with my friend, go to this conference, have a little holiday. So that was kind of what it was at the time.
Fair enough. And then I mean, because you're working 6 days. So I mean, how did you find time?
just where you could. By that point, that was a year that I applied as well to the program. And I kind of had it in my head that I had to save up some money, because I knew that during the program, I didn't want to, I'd spoken to a few friends who'd done other specialist programs, and they said, you know, you do need some savings. You don't want to be financially stressed on top of all the other stress that's going to come if you get in. And so I was just planning, like, whether I did or didn't get in, I just thought better to have some money saved up. So I was working, pretty flat out 6 days. And then, just if I saw something that was worth it, I would just take a day off and do the course. But it wasn't easy, but I think, you know, you just manage your own time accordingly.
Yeah. So during this time, like, obviously you're kind of planting the seeds. You're signing up for the Endo Society study club. So you kind of have, you know, you're kind of interested and you're kind of working your way there. Are you doing a lot more like endo courses as well? And you're thinking like, actually, I want to take it to the next level. Like, at what point are you thinking, I want to specialize and, you know, this is actually something I want to commit to?
Yeah. So, I mean, I think it was partly because I'd been watching all these specialists in the Air Force, and I'd seen these guys like really good at their field. Just, you know, they just know how to do X, Y, Z. They nailed it. And I'm there just thinking, I'm okay at a lot of things, but I would like to be like that. I'd like to just be good at this thing. And I knew endo was something that I felt really interesting, really challenging. I look back now and I realize how little I knew at the time, right? But at the time I was thinking, I really enjoy this. Each case is a challenge. And so we didn't have any visiting endodontists in the Air Force, but I actually organized with an endodontist who we were referring cases to. David Barnard in Castle Hill. And I asked him, I said, do you mind if I come? And he was so generous with his time. He was like, yeah, turn up, spend the day. So I went a couple of times, and man, that was an eye-opening experience. I was like, this guy's endodontics and my endodontics is like so far removed from one another. That, because when I went through undergraduate, we weren't taught rotary instrumentation. We were taught it in a preclinical lab, but we didn't use it consistently in clinical teaching.
Yes.
In undergraduate level. We were hand file, step back technique. And so you turn up at this guy's practice, and David, who is a whiz, just to watch him work, it was a real eye opener. And that was pretty much one of the moments where I thought, you know what, if I can, I'm going to try and get into the program and see if I can do it. And I did a CPD course, hands-on day course with Professor Parashos, who ended up being my mentor at Melbourne. And just to see the way he worked, the way he thinks about cases, and the way he communicated it, I really thought, if I can, that's the program I want to do. But I did apply to multiple programs in the end. Yeah, but that was sort of the point where I decided, let's try and make this happen.
Yeah.
Hey guys, just dropping in to let you know how your CPD can make a difference. On September the 17th, Dr. Harry Mohan and a team of 5 other specialists are banding together to run a charity fundraising CPD. That's Dental Aid 22, CPD for a Cause, where 100% of your registration fee goes to the food security for vulnerable families in Sri Lanka, a country who's at the brink of economic catastrophe. You can book your tickets at cpdjunkie.com.au. So go on, make a difference.
I mean, how was that specialist journey? Was it pretty straightforward? Like you got in within the first year of applying, or was it kind of like you had to go back a few times, or?
So I was very lucky. I got in on my first attempt. But I was ready to, it's a big decision, right?
Yeah.
But at that age, I was single, I was young, I was like ready. I'll travel anywhere. I'll do any program. There were fewer programs at that time, like UQ now has a program. There wasn't one then. I think Gold Coast just started a program and there wasn't one then. So back then it was either Melbourne, Adelaide, Perth, or New Zealand. I threw my hat in the ring for all of them. And luckily, I'm
got
so
into
grateful.
Melbourne, like where you graduated from. And know your mentor at.
That was, so to get in there and to be like, because I had so many great memories from Melbourne University and living in Melbourne. So to go back there was fantastic. So I was fortunate to get in on my first attempt. Yeah.
So then how did you find the specialist program when you finally got in?
It's a punish. It's like, it's pretty brutal, but at the same time, it's so many great memories as well. Like, so many good friendships came out of that time. I met my wife while I was living in Melbourne at the time. And it was a bit of a work hard, play hard mentality going on back then. So you'd spend really long hours at the dental hospital. You'd be there treating patients, then you'd have to do your research, then you'd have to do we had to write seminars on various topics, and each seminar was expected to be about 20 to 25 pages.
Wow.
But then my classmate, Theo, I don't know if you know Theo Chan, he started writing 100-page seminars. So then the rest of us were like, dude, you're ruining it for everyone. So then we all had to up our game a little bit. So you'd spend hours at uni writing these lengthy seminars, just trying to go through all the literature. You'd have to write up your cases and justify why you did whatever you did for each case. But at the same time, you're there 12 hours, but other people are there with you and you're talking about things, and not just within your discipline. Like there were ortho guys and perio guys and pros. And so we would all get to talk to them about what they're doing, and it's just a shared experience. And so like anything that can be a bit of a challenge, if you get to share it with someone, it does become quite rewarding and enjoyable.
Like a collegial kind of experience. Yeah.
Exactly right. That's exactly right. Yeah.
I mean, are you working at this time? Because some people talk about how when they're specializing, they might pick up a day on the weekend just to kind of work as well to kind of just balance it out? Like, how are you finding it?
So we had to work as part of the program through the primary care service of the hospital. So the emergency service, the idea being that you would see pulpitis, you would see trauma, and you would have to deal with it firsthand. And so that's after hours. So that's in the evenings and on weekends. So, and there was a expectation that you would do X number of evening shifts and X number of weekend shifts or whatever it was. And that was actually a really, really valuable experience, because in practice, you don't always get to see the trauma firsthand. And then so to see them from the minute they had the injury, and then to manage them ongoing for a year thereafter or 2 years thereafter, and see that full progression, that was really valuable experience. And then outside of that, the rule was you weren't meant to work. But everyone worked on the DL, but you weren't meant to. And so, I had like a job I worked in Collins Street, NIB, for a little bit in first year. And then I worked in another lovely practice in Fitzroy, I think, or Sydney Road, for a little while, where that was a bit later on, and they just asked me to do their endodontic cases. And so that was nice too as well. Yeah, but you didn't want to have, again, like for anyone planning to do or thinking to do specialist training, you want to have enough money saved up where you don't need to do that, because if you don't need to spend your time there, you can do so much better things with your time during the program.
Is that what you're seeing with like other colleagues who had saved up and didn't have to work versus when you had to work? Is that what you're saying? Or
I think, to be honest, we all ended up working a little bit here and there, but if you didn't have to, I mean, even just catching a few extra Z's, or just just being able to do something that you just switch off for a bit would have been fantastic. So
I mean, how did you tackle it during this time as well? Because like you said, you met your partner during this time. You're busy, you're working, you're studying late. Like, how's life happening?
It sort of goes on, I guess. I mean, I couldn't even imagine how some of my classmates who had like spouse and children, well, I don't know how they did it. That's beyond me to think now. But I was a bit younger. I got in 2013, so I was 27. And my girlfriend, now wife at the time, she was so supportive. Like, I remember she's not in dentistry, and she came in and like helped me scrape the PDL off extracted bovine teeth for my research and stuff.
Wow.
So, you sort of get support.
You're like, that's the woman. That's the woman.
Your friends and family. It's as I said, it's adversity, but it's a shared experience with the people going through it with you in the classroom and also outside the classroom. So my roommates had a great old time, and it was good. It was good.
So, okay, now you're finishing up, right? So you decide to come back to Sydney. Is that what happens at this point?
Yeah, I mean, that was a big decision, and I won't name any names, but people were like really saying, there's not much work. Throughout the program, people were always saying, there's not much work. There's not much work. It's a bit hard to find work, in particularly in Melbourne. They'll say, it's not easy. It's not easy. Yeah. And a couple of people that graduated before me also went interstate, maybe for that reason. I don't know. And so I just sort of had it in my head that there wasn't any work in Melbourne. And having grown up in Sydney, I thought, it'd be nice to go back. And so in my final year, I started speaking to people in Sydney about is their work. And Dr. Marcus Yan and Dr. Alan Nerwich in Sydney Endo, they said, we'd like to interview you. And so I went through an interview with those guys and started work there. And that was fantastic. So it wasn't, and then ironically at the end there was heaps of work in Melbourne. There's heaps of work in Sydney. There's heaps of work everywhere. So I don't know what that was all about, but I just had it in my head that I'm never going to get a job here. So I head back to Sydney and try my luck there.
Yeah, fair enough. So you come back and you're working at a specialist group practice. How was that?
Fantastic. So it's strange, right? Like, so I was 4 years out as a general dentist, thinking, I'm not that great at any one thing in particular. I want to get great at it. And then I do my master's, I come back. It's just being like a new grad all over again. You know, like you're just starting from scratch, even though you've done 3 years just doing one thing. That first year in specialist practice, the case complexity is much higher.
Yeah.
I don't know whether this is true, but I certainly had this in my head that expectations were really high, that all of a sudden, you know, the buck stops with you as the specialist, that, you've got this patient who has been sent to you, and that, you know, you got to get them a result, hell or high water. So I was putting a lot of pressure on myself. And that was not going well for me. I was really stressed out, like to my eyeballs. Yeah. And then, but being in a group practice was so good for that, because in particular, Dr. Marcus Gann, he really took me under his wing. He sort of showed me his own cases, which maybe like both the good and the bad. And so I was like seeing, oh man, this guy who's, you know, got 10 years more experience than me is still, you know, not everything goes to plan. Yeah. You know, you can't solve every case. Even if you're the specialist, you know, there's some things that you need to understand that there's limitations. So to have that person to just sort of guide me through it it made a hell of a big difference for my mental state. And that made me enjoy my work a lot more. It really changed the way I thought about cases. And also like the way I felt about my work as well. So being in a group practice, it was a game changer. I couldn't even imagine if I'd gone into solo practice day one, how I would have navigated. I mean, I'm sure I would have, and I know other people have. Yeah. But I think having Marcus and all the other, there's a big group at Sydney Endo. And there were 2 new graduates, myself and Liz, started together that year. So to share those ideas, and again, it's like safety in numbers. So I think definitely it was the right move. Yeah. And that's the same for a general dentist as well. You know, like the more people around you, the more people you can share your findings with and your experience with, the better.
Yeah, I definitely would agree with that. I think a lot of graduates think that they can come out and they can work alone far away, and, you know, that's okay. But it's sometimes, yeah, like you said, when you come across tough cases, you really need to kind of get a second opinion to kind of help maybe like people think out their thoughts, like they process it a little bit better. Yeah. I mean, you said yourself, like, yeah, you felt like when you're going out, you had a high expectation. How did you kind of break out of that shell? Because sometimes people end up in situations where they're just thinking about themselves, but they don't think to reach out, or like unless someone, you know, asks them, and they might be resilient to it. I mean, where are your headspace at the time?
Oh, I think now, particularly the way I approach things now, it's all about setting it up from the beginning at the consult. So, and I've actually benefited a lot from, I did Mark Hassed's course, the communication and case presentation course.
This is when you're in general, or?
No, this is actually after I graduated. So not long, maybe like last 2 years ago. Yeah. And I was the only specialist in the room. Yeah. Which was interesting. Because even that course, a lot of it is obviously geared at general dentists. Yeah. But I got heaps out of it. And Mark's style of communication really resonated with me very much, very relaxed, as he says, and matter of fact, emotionless. Like, you know, don't buy into the emotion of the situation. Just say what it is, say the facts. And so setting it up from the outset where, you know, you talk to them about failure at the consult, not failure, but, you know, we may not be able to get you the ideal outcome every time. Majority of the time we can, but there's always going to be a percentage of cases where even if everything goes well, you know, we're dealing with disease here. We can't predict how it's going to respond. So setting it up in that sense, both in your own head, so that you understand that, you know, you can't solve every problem, but also that the patient understands and accepts that, and the language that you use to present that. So now every case I say, you know, so you have to be comfortable with a level of risk that this might not work, but majority of cases are going to work. So you've told them, like, in no uncertain terms, that they have to be ready that things might not work out. that really sets it up. So then that way, if you do your best and things, just don't go the way you planned, then so be it. Patient understands that. Patients generally don't get upset. Now they're like, yeah, you did say that. And then the other thing is, don't rush through the case, especially with endodontics. You get so many opportunities to observe for healing before you finish. So a lot of the cases I finish, when it comes to obturation, I'm already seeing radiographic healing. And that's for a number of reasons. One, I like to do that because it gives me in the patient confidence. Yeah. Two is if I space my patients out a bit, it frees up my appointment book for new patients. But yeah, in endodontics, never rush. Don't feel like yeah, there's evidence to say single visit endodontics works, but it doesn't give you that. Like if you got this buffer of, yeah, I can bring this patient back and just make sure it's all going well and we're all happy before we finish. Why not use that to your benefit? Like, what do you got to lose there? So these are the sort of things which I think just make your life a bit more predictable, your work a bit more predictable and a bit less stressful.
Yeah, that's an interesting point. Yeah, because when I talk to my colleagues as well, sometimes we debate about that space between that first visit and the second visit. Sometimes they're like, no, I've heard that we've got to bring him in really quickly, come back in 1 or 2 weeks and try to finish it off really quickly. But to your point, like what you find is that if we can prove that there's, radiographic evidence of healing, like you feel a lot more comfortable going ahead before finishing it.
I mean, each case is going to be different, right? If it's sinus tract, I'll leave it 6 to 8 weeks, see the sinus tract healing. Okay, I got the tick. If it's, radiolucency, I might leave it a bit longer, maybe 12 weeks. I'm seeing radiographic signs of healing and absence of symptoms. Wow, I'm really happy. But each case is different, but that's the point I'm trying to make, is that you have certain things that you can use to gauge like how things are heading. Why not use them? And that just takes the stress off everyone.
So you're at this specialist group practice. Are you moving it around multiple different locations?
Yep. So I was. So that group had 3 practices at the time in the Sydney city, in Bondi Junction, and in Miranda. Yeah. So I was living right in the city in Darlinghurst on Oxford Street. A lot of fun. Nice. And could walk to the city, bus to Bondi, and drive out to Miranda. And again, like that was nice too, because each day I'd work with a different endodontist at the rooms. Yes. So got to, sort of like my general practice experience. I kind of did, a few days with someone, a few days with another person, a few days with another person. Demographics very different at each place. And so that gave me a bit of variety as well. So I really enjoyed that.
Yeah. I mean, like, look, things are looking pretty good at this point, but you decide there's the point where, people start to contemplate opening up. So talk to me through that mindset, because like you said, things are doing okay at the moment.
Yeah, so things were doing well. It wasn't crazy busy in my first year. So I just had a friend who's an orthodontist in Shellharbour, and he was like, if you want, why don't you come down and do a day a fortnight here? So I ran that by my bosses, and they were like, yeah, you know what, until things pick up, why don't you do that? And I did that, and I went down there, and I kind of had that little bit of autonomy, and I just fell in love with the referrer base down there. It was like, in specialist practice, one of the benefits is you get to start to communicate with your community of dentists really well. Like when I was a general dentist, I was working in 3 locations, but aside from the dentists within my practice, maybe like 1 or 2 neighboring practices, I didn't really know anyone. Yeah. Like I didn't talk. I knew my mates from dental school, but in my locality, I didn't really have that network. Yeah. Whereas at specialist practice, because you're working with so many referring dentists and other specialists and so on, I got to really build this network of people. And I just really started enjoying working with them. Lovely people down there, yourself included at one time. And I mean, I don't know if anyone listening has worked in the Illawarra, but it's a fantastic place to work. Patients are very, there's lovely people down there. It's very relaxed. The dentists are all quite busy. And so, a lot of them, they refer their cases because they're busy enough as it is. And I found the work really rewarding.
Yeah.
So that sort of gave me this idea that, okay, yeah, I would like to work down there. And then so I transitioned over the next 2 years to full-time practice down there.
Right. Look, I'm going to agree with you. Yes, full disclosure to our listeners, yeah, me and Dr. Mohan, we've worked together in the Illawarra. I've worked there while it's my time in Dapto. And I 100% agree with you. The days that I'm down there, it's a completely different environment when I compare it to when I'm working in Sydney. Like, people, I don't know, like, you just know people across the road, like, you talk to them, like, they're not your competitors, you know who they are, you can speak with them, you can, even people in neighboring suburbs, like, you just know who everyone kind of is. It's such a different, like, environment to when I'm back in Sydney, where, like, to your point, it's just the associates within the practice. That's pretty much your circle, or your immediate close friends. Like, that's it.
Yeah. So I think
Yeah.
that sort of community down there really spoke to me.
Yeah. So things have gone great at this point. You're transitioning full time to the Shellharbour practice. And at this point, you're starting to think about Gregory Hills. At what point does Gregory Hills kind of come about?
Yeah. So there was a few thoughts that went into that. One was that I was lonely. I really wanted someone to work with me.
Yeah.
And as much as I love working in the Illawarra, it is and has proven difficult to attract talent, because I guess with specialist clinicians, there's not that many of us.
Yeah.
And so most people want to live in Sydney, or a major capital centre.
Yeah.
No traffic, cheap houses and all that.
It might change now with COVID and everything, yeah, but yeah.
Most people want to live in major cities. And so I thought it would make sense to have something a bit closer to a major centre. Gregory Hills is in southwest Sydney, where there historically has been no other specialist endodontists there. And so it's a growing area which was in need of specialist practice. And it linked up with the Illawarra in that it's all in that sort of south and southwest corridor. And I was already getting a number of patients from the Southern Highlands, Bowral area.
Yeah.
So it was just the next logical step for me to do that. And so I actually had spoken with now my colleague Aaron, who while he was in his training program, and he was keen to join me, and so we had that discussion that, would that sort of work for you, and it did, and that sort of all tied in together. So yeah, that was the next step.
Right. I mean, a lot of graduates as well, around the 4 or 5 year mark, we start to contemplate about, practice ownership, being a specialist, being a super GP. You've kind of gone through like different parts of that during your life, but would you say you've had some of those thoughts about practice ownership maybe earlier on when you were still a general dentist, was always being a specialist? I mean, or thoughts about being just a super GP as opposed to specializing? Like, what are your thoughts on all of that?
Yeah, I mean, I certainly did. I had all the way through, I've had, I guess, people a few years ahead of me, or people going through it with me at the same time. So my classmates or friends. There's an orthodontist, Dinesh, who I'm very close friends with, who sort of I just followed what they were doing and sort of observed what they were doing. And so he'd gone down the specialist practice pathway. And then a couple of my classmates had gone into the ownership pathway. And so both of the options sort of spoke to me and seemed attractive. But it comes back to where I was earlier, where I still didn't feel like I was a gun at any one thing. And that sort of, I still wanted to be good at what I was doing, like really good at what I was doing. Not that I'm not still learning now. Like I'm still I'm still improving my work year on year on year. Yeah. But I don't think that ownership would have given me that. I mean, it would have, but it wouldn't have fast tracked me to that. I still would have had to go through all the hurdles of, and hats off to general dentists who, do constantly work at every part of their work until they're, at that level.
Yeah.
But then on top of that, I would have had ownership as well. So I just thought this worked for me better.
to go down the specialist route first and then going through that experience before opening up.
Yeah. And even like ownership of specialist practice, I didn't contemplate it straight up. Like I worked as a specialist for a bit and then wanted to understand the market, wanted to understand the risk, and then went into the ownership side. And like, whilst I share a lot of the difficulties that general practice owners would share, I also avoid a lot of the difficulties that general practice owners would share, in that there aren't that many endodontists. So I'm fortunate in the sense that, in that sense. So if I position myself well, there should be enough work for myself and others that work with me.
To kind of
That's right. Yeah.
I mean, do you have days where you think back, I just wish I could be just as, a general dentist with a special interest in endodontics?
Not really. I mean, honestly, yes, there are days that are super stressful. Yes, there are days where the cases just don't go to plan. But at the end of the day, I do enjoy what I'm doing.
Yeah.
There is a satisfaction in knowing that I'm getting better and better and better at this one field, and that I feeling more comfortable there. And even when I graduated, my boss at the time, Alan, said, first 4 years, you're still learning. And then after 4 years, you start to feel confident that almost every case that comes through the door, you'll be ready for it.
Yeah.
And so now I'm at year 6, and that's how I kind of feel. Like, most of the cases that come through the door, I'm pretty confident. But at the same time, still learning. So I'm still, like, me and my endo classmates are in like WhatsApp groups, and we, throw cases out at each other and ask questions. Or like, I still listen to podcasts. I still follow other endodontists online and see what their cases are and see, oh, well, okay, yeah, they're doing something a little bit different. Or I try and attend courses in that sense too. Right. And then even within dentistry, like general dentistry, I'm still trying to learn more there, because I can't just cubbyhole myself into endodontics, because my patients have other needs, like, so let's say, they ask me questions, I need to be able to answer them accurately. So like, if it's a case where the tooth can't be or isn't appropriate to treat, and they're going to go down replacement options, I need to have a good understanding of that. Or especially now, I'm finding a lot more cases where there's a bit of overlap between TMD, bruxism, and their endodontic needs. So that's where I'm trying to now focus my learning down that pathway. And then even within endodontics, we're shifting so much. Yeah. So it's like, there's all sorts of changes afoot in endodontics, which I try and keep abreast of. And so there's a big group in the United States, or it's a global group really, called TDO group, where I try and keep abreast of what's going on there. So yeah, it's a constant learning.
Yeah, amongst all the busyness that's kind of all happening. So yeah, I mean, so you mentioned you've got, if I'm correct, just correct me if I'm wrong, sorry. You do hands-on courses, you've got online courses, you've got study clubs, you've got CPD, you've got podcasts. That's where you're kind of consuming, like, because some of our listeners want to know, like, when you're a specialist, how do you upscale? Like, how do you upskill? Like, how do you...
Yeah. Well, there's a few things. So I guess podcasts I like, because I just whack it on when I'm in the car, and you get like a little tidbit, but more importantly, you get to like listen to the speaker, and you get to sort of get a feel for their communication style, like the way they present, the way they think. Is it logical? Like, I hate when guys just get up there and plug, like, oh, it's got to be this product, it's got to be this product, it's got to be this product. Yeah. Like, I like to think about, why are they thinking this way? If I use some other product, could I still achieve the same thing? I want to know more about the principle, not the product. So I use that as one thing to just sort of get a feel for who the speaker is or who the educator is. Yeah. Then I can sort of decide, do I want to do their course, or do I want to, and then the same thing as I look at their, I'm not a big Instagram person, but I on Facebook, I see a lot of people's stuff. And so and I like the commentary, like what's the commentary they're putting with their cases. And if I sort of like appreciate their way of thinking and then the way they reach the end point of each case, then I really want to sort of learn more about what that person's doing.
Yeah.
So that's sort of how I've been approaching it. But that's only nowadays because we got all this stuff available to us. Like, it's so easy to come by now.
So what kind of podcasts do you listen to?
Well, I listen to News Head Start.
Yeah.
Yeah.
Dental Head Start?
Dental Head Start.
Yep.
There's a guy in the UK, I've forgotten his name. And I listen to...
Is it Karma Dentistry or something?
Oh, I couldn't tell you. Sorry, I'm really bad at this.
That's all good. Oh, was it no, but you're saying it's endodontics related or not?
No. So just general.
Protrusive, I think, right?
Yeah,
Protrusive
that's the one.
podcast.
Yeah, that's the one. So I listened to his one. I listened to Jesse Green.
Right, you consume a whole range of like not just endo, but like you do the whole gamut of general dentistry. Yeah.
Because that's how like I like to learn more things about non-endo stuff as well, because I kind of have my endo feed that's always going. Like I get through TDO, I get the emails through my mates, I get cases through my own work. When I'm doing CPDs, I have to then refresh myself on what's the latest. So I'm constantly inundated with that.
Yeah.
Sort of that's always in the background. And then Aaron and I can discuss our own cases. So that's always happening. So then for more the non-endo stuff, I sort of just like to have a bit of a breadth of topics going on.
So are you doing CPD and specialists in Australia, or are you doing CPDs in regards to endo overseas, or when they come here? Because one of our previous guests, Dr. William Hart, he's mentioned like when Yoshi came over, like he made an opportunity to attend that. Yeah.
Oh yeah, Yoshi's course was awesome. So when they come here, I always try and do it, especially if it's a hands-on.
Yeah.
So one of the really good ones I enjoyed was Dr. Steve Cohn, who's a local retired endodontist. He organised for Thomas von Arx, who is an oral surgeon, but who has done a lot of work in apicectomy and root end surgery. So he organised for him to come and do a 3-day program on 1-day lectures, 2 days on cadaver heads at the things at Royal North Shore Hospital. Man, that was awesome. That was so good. I was already been out 2-3 years by then as a specialist. But to have a world-renowned expert who has pretty much published all the literature, not all, but a lot of the literature in that field, come share his experience, see his cases, because when you look at papers, you only get to see a few. They'll only ever put 1 or 2 pictures in each paper, and then the rest is writing. So he presented, 20, 30 odd cases and completely changed the way we think about surgery in some instances. And then to be able to do it on cadaver heads, because surgery can be quite stressful. You never know what you're going to get. You could lift a flap and it's just won't stop bleeding, or all these things. So to be able to do it on a cadaver head, low stress environment, you can't get any better than that, right? So that was hats off to Steve for organizing that. That was awesome. Then there was Yoshi's course. I did that not long ago, file fracture removal. That was fantastic as well. And to not have to fly to Japan to do it, just made it a hell of a lot easier, because, not having to take time off work and the expense of all that, just made it to make that more accessible to us. That was fantastic. And then recently, Dr. Oliver Pope, he's heading up the federal ASC at the moment, and he's been organizing some fantastic overseas speakers through webinars, and also we've got the Trans-Tasman Endodontic Congress coming up in a couple of months. So just taking those opportunities where they come. But a lot of the US conferences, or at least one of the big US conferences, the TDO meeting, they actually record all the lectures and you can buy them. So you pay $20 US and you get each lecture. So I do that as well. And that's been good because I think you run the risk of just being stuck in your one way of practicing. So you always want to get influenced by other people, and you should never blindly follow one person, but you can always take 15% off one person, 15% off the other person, and just sort of build your own way of thinking. Or, eventually everyone's going to do things a little bit differently, but there's so much to learn from everyone.
Have there been any particular courses that you felt you did not implement or was not as beneficial for you at the time and you would do differently next time?
No, to be honest, I haven't ever gone to, sorry, I take that back. I've been to a couple of courses, and I won't name the companies, but it's definitely company plugged. And it's just, the speaker is hamstrung on what they can talk about. They have to say to do these certain ways.
Yeah.
And then sometimes you just think, oh man, I can't believe I took a day off to go to this. So I have been to a couple of those, but I guess now I'm a bit more discerning, so I don't waste my time with those anymore. And I think we've all been there. And I've been to some where, where the sponsor was given a spot to talk and they talked for half an hour. And you're just oh, this is so painful, and not evidence-based at all. But I think one thing that we can do as consumers of CPD is you can give your feedback. So as a presenter of CPD, I'm working on a new program now for a new course. And I just threw some questions out to general dentists and said, what would you want to know? And what don't you need to know?
Yeah.
And so same when I went to that course and the sponsor spoke for half an hour, I was really annoyed, but I just politely wrote to the person who organized it and said, hey, that wasn't that great. I know the sponsors reduce the cost of the thing, but for me, time is the most valuable thing these days. So if I'm going to take a day off, I just want the content to be really, evidence-based, bias-free, and just a balanced view. And that person, that presenter, or the person who organized that, came back to me and said, hey, you know what, thanks. We're actually going to make sure that doesn't happen again. And so I think as consumers of CPD, if you can do your feedback politely, like anything, constructively, then it's just going to lift the standard across the board.
Yeah.
That's
a good point. So you've mentioned that you've had a lot of, mentors along the way. A lot of graduates want mentoring as well, but people interpret that differently, right? So some people like to be held by the hand. Some people want to be checked in once in a while. People want to be a fly on the wall and just observe. What are your thoughts on, graduates looking for mentoring?
So I think you got to have mentors. You want to have more than one. You want to have them at all different levels of experience. So even when we think mentor, we think Master Yoda, old guy, done everything, teaching the new person, but you can have even since Aaron joined me as a recent specialist, I enjoy learning from his way of thinking and sharing ideas. And so I would, if mentorship can go with anyone, you can learn anything from anyone. So I would say just, find anyone that seems approachable, that you feel comfortable with, because you don't want to, be quivering in your boots the whole time. So it's got to be someone that you can feel comfortable around, so you can actually take it all in and learn and ask questions confidently. Find people that, and then don't be afraid to ask, what's the worst that can happen? They'll just say, nah, sorry, too busy. But I think the people you want to ask is maybe people you're already referring to that helps in your area, specialists. They're generally going to be pretty generous with their time. Within your group, your dental practice, learn from them. Within your mates, ask questions. Be careful of the answers you get, I guess. Sometimes, can be the blind leading the blind. But still, it's always good to ask. Never be, I guess you just want to have a group where you feel comfortable to ask questions. And so I think if you see stuff on social media that you're curious about, you can always private message that person. Again, I guarantee you'll get a response, but what's the harm in asking?
Yeah.
But yeah, I think there's a lot of benefit in mentorship over courses. I mean, you still have to do courses, I think, because that you get a lot more, you get a full structured learning set. But I think you got to back it up with some form of mentorship.
Have there been any particular struggles in your journey so far that some of our viewers might not have known about?
Yeah, I think that first, as I said earlier, that first year out of specialist practice, that was tough. I found it really stressful. And I think had I not had a really, I guess, a mentor with me, a boss who really took me under their wing, that would have been really hard.
Yeah.
So that was a really unpleasant first 6 months. And I think it was all in my own head. Like, I think a lot of it was just I was putting way too much pressure on myself. But I know, and I've seen it on, like, posted on our dental forums, I know other people go through the same thing.
Yeah.
Where they're just like, oh man, I'm not cutting it, or you're just down on yourself. And sometimes you even see students post it during their undergraduate study or their postgraduate study or whatever. So yeah, I think I have been there.
Yeah.
And
because I mean, like, I guess a lot of dentists are high achievers, right? So they're coming out at top level. You went into a specialist, so you have to, be at the top of your game as well, and to get through that as well, and so we're so, like, primed for, like, needing to achieve and succeed, right? That sometimes we set that such a high expectation on ourselves. So, and then when you come out in the real world, like, just, you said, everything just gets thrown at you, and you always want to, have the win, right?
yeah, I mean, it's not easy. And even, like, just recently, it was at the beginning of the pandemic. I had some time on my hands, and I thought I had never really posted a clinical case on social media before because I was nervous. I was like, oh man, you're really putting yourself out there to scrutiny. And so I thought, all right, I've got some time on my hands.
Yeah.
I'm not gaming too much, so I'm just going to, like, do something constructive. So I thought, okay, I'll put a case up. And I put one up, and it was Cal, who's, like, really prolific on posting or commenting on social media. He kind of said something really positive, and it just gave me a little bit of confidence that, like, okay, you know what, this is not so scary. Maybe I'll just share a bit more. And I think we all have that. We should be, as much as we can on these forums, just be really positive and, like, not, like, just pat everyone on the back. Like, yeah, you got to be honest. Like,
yes.
If someone's doing something that you think they could do better or differently, yeah, you should say that. But just say it in a positive way as much as you can. And especially because of the internet, as we all know, is, like, can be so prone to misinterpretation. I think you got to be careful what you put on there. And so, and if you see someone being a bit of a tool, like, maybe we should be calling it out, because I think these sort of forums are really good when they're good, and they're terrible when they're bad. So I think we just trying to make these places a bit more positive.
Yeah, that's fair enough. So can you share with us what you hope your ideal clinical day or non-clinical day might look like in 5 years' time, and what you want to do to kind of get to that point?
Oh man, 5 years' time. Yeah, all right. So I'll be driving to work in my flying Tesla car, maybe. Who knows?
Autopilot.
Yeah, I think I just like, from a ownership point of view, this is where I'm learning the most at the moment. So I just want to have a really upskilled team who feel empowered, who are still there 5 years later, who haven't moved on to other jobs. And where, anything I can delegate with confidence that, I've taught this team to work really well with me. I think that'll be lovely. I'm sort of toying up with the idea of how I can best do that. Maybe is there some way to introduce a therapist into my practice who can assist me in certain ways, and improve the standard of care we're giving. but let's see on that front. I probably like to have that work-life balance, and we just had a baby, he's 9-month-old now, so I'd like to be there, not at work too much. So fairly civil hours.
Yes.
And yeah, just a collegiate environment with a couple other endodontists working together. I think that's the dream.
Are you getting consultants to kind of help you come up with it, or is it more like, bits and pieces that you're hearing about to kind of decide how you want to navigate that practice ownership side of things?
So again, same sort of following the same approach that I've been following to my clinical practice. So I went to a course on dental practice ownership. Again, it's a bit tricky when you're at specials level because everything's geared at general dentists.
Yeah,
but you still
general bigger market, right?
Of course, yeah. But you can still learn heaps from that. But I learn a lot from US as well because there's way more endodontists there. There's like 10 times the amount of endodontists in the US than there are here. So they have more practice ownership modules and so on there. Like they even have dedicated software practice management software for endodontists. So there's a bit to be learnt from them and to bring their experience into Australia. But then a lot of it is again just having that network, having other people going through the same thing, sharing ideas, just collaborating.
Yeah, that's fair enough. So would you share, if you could share any words of wisdom to your younger self or to a budding young dentist, what would it be?
I think it might sound like a broken record, but yeah, don't be too hard on yourself. But at the same time, always critically analyze or critically assess what you're doing. If you stop doing that, if you just start churning out cases and not reviewing them, for example, or, you get into solo practice, but you never go to CPD, you never meet other people, you don't watch other people's cases, you're going to head, there's only one way you can head, and that's down. So you really want to, be aware of what's going on around you, be aware of what you're doing yourself, and just always try and see, okay, am I doing things at the right standard? What can I be doing better?
Fair enough. We had an opportunity to throw ask our community for questions, and one of our questions that we got from Dr. Ivana Zimmerman was, what are your thoughts on the future direction of endo CPD programs, and what do you think can be improved in current programs available?
Oh, thanks, Ivana. So that's a good question. I think it's tricky to meet that balance between delivering the content, the verbal lecture content, and the hands-on. There's a lot going on, I think, globally in terms of these several weekends courses where you get to do a little bit each time. I think that's a good model. But I think it's got to be approached with the right mindset, because you don't want to have a situation where you get shown how to do something which took, for example, me 3 years of postgraduate study and then 6 years of specialist practice to feel comfortable doing. And you don't want to learn it in a weekend and then think, yep, I'm ready to go. So as long as you approach these things with the right mindset, I don't mind that sort of level of practice, level of teaching. But I also have spoken to a lot of dentists, and I think a lot of them find that there's still a lot to be mastered at the just your bread and butter endodontics. So I think, and even in my own practice, when I get cases referred, I think a lot of it is missed at diagnosis. So a lot of it is misdiagnosed. Cases where maybe the treatment's been started, tooth's been extirpated, but the symptoms are still there. And you really start to question, maybe we need to just take a step back, and maybe we didn't get the diagnosis right then. So I think there's so many fundamentals, diagnosis, access, instrumentation, all these basic things we consider to be basic, which are actually a lot more challenging. And even now, they're the things that I am always trying to refine my own practice in. So I think there's a room for more focus to be spent on that. But the tricky part comes down to time. If it's a 1 day or even a 2 day course, a 1 day course is really hard. We try our best to distill it as much as we can, but there's always going to be some sort of things that we just can't cover. So whether you then follow that up with sort of, being in touch with that presenter and just asking questions as you go, or going back to your area of practice and being in touch with your mentor in that area and just asking questions as you go. I think that could be something that where you sort of tie it in with a long-term network. I think something like what Pat Caldwell's doing with EndoSpot Academy, that seems to be pretty good. I haven't been, I'm not a part of it yet, but as a student, but I think it's something where there's that ongoing study and ongoing mentorship bit by bit, and you can learn a bit from that.
Yeah, that is interesting, because I would say that amongst my colleagues as well, like you would think the instrumentation, the diagnosis, like that seems like, or like that's, I think I should be finding it now. Like I want to hear about the other stuff, the more interesting stuff that I have difficulties with.
I know. I think that is, maybe I'm generalizing, but yeah, I think you do get a bit of that. People who think, I'll let that at dental school, like, what more is there to really be learned?
Yeah.
But even me, like I'm changing my approach every couple of years almost. And I think there's certain things that we overlook, and access is one where in particular, like when I teach, I spend a long time on access and canal location, because that's one thing that I think most dentists tend to not get right. And if you can get that right, it just sets you up for the rest of the treatment so well. So if you can just nail that first bit, and obviously diagnosis even more so, because you get that wrong, you're going wrong the whole way.
That's right.
Yeah. So I
guess
think
one of the things I would take away would be that, I guess, you got to do a lot of tests. Sometimes it's not just like your TTP cold test and then you're like, okay, we're good now. I've got the X-ray that puts it all together. But you got to do more tests to kind of confirm everything.
that's right. Yeah. I think a lot of people don't appreciate the probabilistic nature of testing. So, just because EPT was positive today or negative today, sorry, I don't know if you can hear my baby in the background. It doesn't mean that it's actually reflective of the pulp status inside the tooth. So, and the more tests you can combine, the more reliable the finding is versus the actual situation inside the tooth. So you don't want to just take one test and then think, because what we often do is we see a radiograph and we think, oh yeah, it's this. And then that colors all our thinking for the rest of the diagnosis. So you want to try and approach each case with an open mind, do as much testing as you can, combine that information, and then go from there.
That's fair enough. Well, there's so many more questions I want to ask you, Dr. Mohan, but that's all the time we've got for today. Thank you for coming on the show. If you could let the people know how they can find you or what you've kind of got going on in your life.
Yeah, sure. Well, thanks, Lawrence, for having me. I was really stressed out about this, but actually went really nicely. Thanks, man. So yeah, I post a bit of cases quite regularly, maybe like a couple of times a month on Facebook. So if you look me up, H Mohan Endo is my / H Mohan Endo. You'll get me on Facebook. Please don't add my personal profile because you'll just get boring pictures of like babies and cricket memes and stuff. So, but yeah, my professional page is where I put most of my clinical content. I do a few courses in New South Wales. So I do some with ADA New South Wales. Got one coming up with Dr. Jeff Young at the end of February. And I'm just starting some programs with Henry Shine at their Mascot Training Centre. Again, where focus is really on teaching the principles of endodontics, not necessarily the product. So yeah, that's coming up in March, and then hope to do a few more later on in the year. I practice in Gregory Hills and Shellharbour. So if you happen to practice in Southwest Sydney or in the Illawarra and you don't already know me, just give me a shout. You're always welcome to come. Anyone is really welcome to come and watch us for a day as well. We have like big 55-inch television that streams what we're working on through the microscope onto a big monitor.
Nice.
So you can see firsthand what we're doing, ask any questions you want, whatever. Always happy to get in touch with people in that sense. And if you want to hit me up on Facebook about questions you got, please feel free to do that. And then we also have 2 private Facebook study groups, one in the Illawarra and one in Southwest Sydney. Again, just PM me and I'm happy to invite you to those as well, where we sort of, I guess, just had the idea that if it was more of a closed forum, people might feel more comfortable, asking questions. Just open door policy kind of thing going on. So happy to help.
Yeah, I mean, I admit I've posted on there a few times, and thank you for the feedback as well.
Yeah, a pleasure, Lauren. Yeah, always.
So you're still waiting for that cricket century, are we?
It's not going to happen, but you always dream.
So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie podcast. Thank you.